So your dentist basically needs a little bit more knowledge as to what's inside your jaw. So bone height, bone volume. If we're looking at the lower jaw, then there's a large nerve that runs through the mandible, so they'll possibly need to locate that. Or there's an undercut in the lower jaw as well that they may need to view. In the upper jaw, obviously, we've got big air spaces. We've got our sinus, our maxillary antrum, and also then we've got the base of the nose. So these are the sort of anatomies that we may want to just be knowledgeable about before we proceed. Patients usually ask the cost. That's a big factor because they've already had possibly a quote estimate from their dentist or their specialist. So is it going to be another £200, £300, £400? So that's the big factor. Time. So can you fit me in today or next week, or have I got to wait 6 weeks? How long will the CT scan take? So our appointments are usually 5-10 minutes long, but we allow sort of 20 minutes for the appointment. So before and after, to explain what's going to happen with the data, and obviously forewarn the patient of what to expect, so they're comfortable for the appointment. So what can happen is your dentist could have something made for you to wear. They refer to it in lots of different ways, so it could be a stent, or a guide, or some sort of marker that they've made for you, either at the dental practice or the lab have made for you, that you wear in your mouth for the scan, and then you take that back out and then take it back to the dentist. So it could be sort of a metal marker or a white marker that shows up within the CT scan, and that acts as a representation of where they're putting the implant. So patients who are referred will have an appointment slot. So we'll go through their data, so we'll check their name and address, date of birth, and telephone number, just to confirm that that's the correct patient. And then we'll also get the patient's consent. So I know that they've driven to have the appointment, they've driven to have the CT scan, but it's also nice just to have a confirmation that they're happy to proceed, they're keen for the treatment. And they're usually very keen because obviously they're attending the appointment. So then we take them through to the scanner, and obviously there's several different seated scanners, standing up scanners. So we stand the patient in nice and tall. They just gently bite together on their teeth, and the acquisition times anything between sort of 5 to sort of 15 seconds. Then the patient's released out of the machine, and then that's it's all displayed on the computer. Concerns are usually the amount of radiation dose that they're being given at the appointment. So depending on the field of view or the area of interest, obviously some dentists prefer to have 1 or 2 teeth in the shot, and then obviously some dentists prefer the whole arch or both upper and lower arches. So depending on the actual area that we're scanning, that will depend on how much the patient dose is received. So that's obviously something down to the dentist and the prescription. So that's usually taken up within the dentist's appointment. Obviously, by the time they've come to us, then they've already had that sort of reassurance given that if we don't have the CT scan, then unfortunately we can't proceed with the treatment that the patient would like. Some patients have a sensitive gag reflex, so it's nice just to warn them on the day of the appointment that they may have to bite onto something for a short period of time, and obviously just a little bit of reassurance and making sure that they're comfortable. If they're nervous, then just try and put them at ease, but it's usually a very quick appointment, pain-free.